Hey guys, our group got careers in neuropsychology. So Phineas Gage was an important person in neuroscience. He was originally Phineas Gage. He was a foreman for the Rutland and Burlington Railroad Company. He was tasked to clear rock in order to have level ground using explosives. While doing this, he was using a tamping iron, which is on the left hand side. There's a picture of Phineas Gage and the tampering iron. He accidentally struck a rock, detonating the black powder, and that tampering iron went through his skull and destroying his temporal lobe and landing behind him. The accident had a major effect on his personality by making him just a completely different person than he was before. Before, he was a good person. He can hold down a job, and he was really good at his job, and he was just pleasant to be around. After he couldn't hold down a job, he was just unreliable, turned into an alcoholic, and he was just aggressive towards everybody. And that played an important role to neuropsychology.
All right, so what is neuropsychology? Basically, it is a specialized field within the clinical psychology field, and it focuses more on the understanding between a person's brain and their behavior and how they coincide together. So they assess like cognitive and behavioral functioning, and they can also assess the designs and effectiveness of certain treatments on patients and everything that you can do. Their expertise is on just different parts of the brain and how they function and work and all of that. A neuropsychologist can serve people of all ages and development, so pretty much infant to elders or just any sort of disabilities or anything like that. So they deal with conditions more so like developmental disabilities, attention and learning disorders, concussions, brain trauma, injuries, epilepsy, stroke, pretty much all of that deals with your brain and all your little functionings and everything. They can conduct evaluations and gather information like your relevant historical health records and anything that can deal with your condition or anything. They can conduct neuropsych exams and then take those findings and data and compile them and then send them back to their referral source. They may also conduct tests and questionnaires concerning psychological aspects of mood, emotional style, behavior, and their personality.
So the path in becoming a licensed neuropsychologist is very similar to becoming a clinical psychologist, and this is because neuropsychology is a specialization within clinical psychology. It takes about 10 to 13 years in post-secondary education, along with supervised experience in total, to become a neuropsychologist. A year or more in internship is needed as well, although the amount of this time depends on the state in which one decides to practice. Most people usually choose a bachelor's degree in psychology, pre-medicine, biology, or other related fields to neuropsychology. A master's degree is optional, but it can help to secure a spot in a doctorate program for neuropsychology. One must have either a PhD or a PsyD to become a licensed neuropsychologist. Most universities actually do not offer a degree in neuropsychology. Instead, they typically offer a doctorate in psychology with a specialization in either neuropsychology or clinical neuroscience. Postdoctoral hours needed to become a licensed neuropsychologist are between 1,500 to 6,000 hours, although this all depends on the state in which one decides to become licensed in. To become a licensed neuropsychologist, you need to get a doctorate in either psychology or neuropsychology and have to take and pass the EPPP. The American Board of Clinical Neuropsychology, or ABCN, offers a certification. Although this is not always needed, some employers prefer or require the certification. In order to receive this, you need to pass the EPPP, have a doctoral degree, and have completed an APA certified internship. After you meet all these qualifications, you have to submit 2 practice samples and take a written and oral exam to receive the certificate. In order to practice clinically, you also need a special license for the state you plan to practice in, and you have to pass the EPPP.
So I'll be talking about the different jobs in neuropsychology. So you can have a job at both the bachelor's level and the master's level of neuropsychology, but at a bachelor's degree, you're just considered a psychology major. But the median salary for those with a bachelor's degree is around $50,000, and those with the master's or doctoral degree is around $105,780. And if you are to become a neuropsychologist, your main focus is to look at the link between behavior and the brain, and you do this by evaluating people. And a typical work setting for a neuropsychologist could be in a clinical setting, and that could be private or professional. They could work in a hospital or rehabilitation center. They may work in an academic setting like a university, or they could work at like the corporate level in a pharmaceutical setting or an industrial or forensic or legal setting. And I have the most commonly listed jobs for both the bachelor's degree and the master's degree level. So at a bachelor's level, you can be a social science research assistant or occupational therapist aide or rehabilitation counselor or a health educator. At the master's level, you can be a clinical neuropsychologist or a clinical pediatric neuropsychologist, or you can be a neuropsychology researcher or professor. So now that you are all more well-versed in neuropsychology, I leave you with this discussion question. What part of neuropsychology did you find to be the most interesting? Thank you.